Welcome back. In this episode, we'll talk about the most important things you need to know about your first pediatrician visits. For many parents, the first pediatrician visit can be overwhelming. It can feel like a test, and you may be worried. Am I prepared? Do I know everything I need to know? If this is you, then this episode is just for you. Okay? Welcome to the Dr. Amaka Namani Show, where we focus on preparation over perfection. So let's get into the episode. Again, you might know a little bit about me at this point. Dr. Amaka Namani, pediatrician, mother, author, but also an entrepreneur. I have been where you are right now. 14 years ago, I was blessed to become a first-time mom. And I remember my very first pediatrician visit. Don't believe I'm going to put this in the World Wide Web, but believe it or not, I was very overwhelmed. I was a first-year pediatrics resident, probably just about 4 months into my residency, maybe a little bit more, when I had our first daughter. For our first pediatrician visit, my husband wasn't able to be there because he had to leave the country. And I remember being so overwhelmed, I couldn't even take my daughter out of her car seat. And nothing in me at the time told me, hey, you could just carry your daughter into the pediatrician's office and finish the visit. I YouTubed it. I was so overwhelmed, and I missed that appointment. I was in the parking lot, but I realized, if I didn't have my car seat ready, then maybe I was going to be in trouble. So what I say all this to say, whatever you're thinking now can be as bad as the story I've just told you, right? So I want you to remember, your pediatrician is not there to test you. We're here to guide you and to answer all the questions that you have for your first visit. Right, so there are a few things we always want to know, right? We talked about this very briefly on the last episode, which is your baby's weight, right? Like I said, we don't want babies losing more than 10% of their weight. Babies typically lose weight in the first 3 to 5 days of their lives, with a goal of regaining their birth weight by about 2 weeks of age. For moms who breastfeed, your milk should be in right around day of life 3, right? So that's when you begin to feel some engorgement, and then you do feel like your breasts are getting full, right? So we always want to make sure that the baby's weight is where it needs to be. Again, we don't expect your baby to have gained all this weight. We just want to make sure that your baby hasn't lost more than 10% of the birth weight, and that your baby's on track to regain his or her birth weight by 2 weeks of life, right? And then we always importantly look at all the vitals. So we look at the temperature. We don't want to see a fever. A fever is any temperature 100.4 rectally usually and over. Babies don't really have much of an immune system. They can't really fight infections because they're just brand new, right? And so when we see fevers, we worry, and that usually is an emergency room visit within the first 6 weeks of life, right? Because we then want to do a full workup to make sure that your baby is okay. Most babies are fine, but that's something we pay very important attention to. We look at your baby's heart rate, your baby's respiratory rate. Now, babies breathe a lot faster than you and I do as adults, right? They make lots of noises, so don't worry about the noises that your baby makes. If your baby's losing oxygen, most times the baby will turn blue around the lips, and that's obviously always an emergency. We also look at your baby's bilirubin level. What was the discharge bilirubin? We want to make sure your baby's not jaundiced. Some jaundice is normal, but again, we use a graph or a chart to see should we be repeating the bilirubin levels at what time, and when should we bring your baby back to follow up with that, right? And a lot of babies are fine, especially if there's if your blood type and your baby's blood type are okay. There are lots of things that can affect that, but those are things that we also look at. And then obviously we look at the rest of the hospital discharge summary, and what we call, if you're in the United States, the newborn metabolic screen, right? So that's basically what checks. We talked about this briefly in one of the other episodes, where we're wanting to make sure that we're not missing any metabolic diseases that could impact your child's life. And if there was something abnormal, a lot of times it's repeated, and then we usually want to follow up with that. We also make sure your baby passed his or her hearing screen and that everything is fine. And if that isn't, then that needs to be repeated. again, we talk about the feeding patterns. We talked about that in the last episode. We want to make sure your baby's getting fed frequently and making lots of poopy and wet diapers. And then we look at the umbilical stump, right? At 3 to 5 days of life, we don't expect that the stump would have fallen, but we also want to make sure everything's okay. Now, as a parent, you don't need to give your baby a full bath until that cord falls. So you don't want to have soap in that area. You just want to give your baby a sponge bath until the cord stump falls. And then I always say, ask all the questions that you have. There is no such thing as a dumb question. A dumb question, in my opinion, is one you didn't ask, okay? I usually recommend that parents have a list of questions that they want to ask their pediatrician so they're not forgetting and they come prepared. There is no question, again, that is absurd or dumb. Our role here as pediatricians is to empower you and to guide you through all of those things. So write all the questions out. And a lot of times as pediatricians, we have helpful resources that we give to you, like healthychildren.org. If you're a breastfeeding mom, there's lots of other resources out there that we usually will give you as a guide. But always remember that no questions are off limits, and we never want you to feel intimidated to ask any questions. For moms who circumcise their son, who circumcise their baby boys, we also want to make sure that that circ site is looking okay. And if there are any questions that you think that you already have that you feel like we did not address in this episode, put it in the comments. I want to hear from you, because that's how I know that this is doing some good in your life. But again, always remember, you are the perfect mom for your baby, and we are here to guide you, and we focus on preparation over perfection. But until the next episode, be well. And in the next episode, we will talk about what happens in the first month of life with your baby. What do you do to prep for the next pediatrician visit, and what are those milestones that you should be looking out for? But until then, take care. Toodles. Bye.